Good afternoon, and thank you for joining us today. General Matt Quinn, the Executive Director of our COVID-19 Task Force, is with me here today to take any of your detailed questions about our COVID response. I regret Vicki, our ASL interpreter, is unable to join us today due to a prior commitment. This is our fourth press conference in 3 weeks, and it's good to see you all. I'll make some brief opening remarks and then open the floor for questions. First, I want to thank law enforcement officers in Montana, in our nation's capital, and throughout our country for their hard work. Following the attacks on the U.S. Capitol, Montana law enforcement has been instrumental at ensuring we keep peace here at home. I especially want to thank the Montana Highway Patrol, the Lewis and Clark County's Sheriff's Office, including Sheriff Dutton, the Helena Police Department, and the University of Montana Police Department for their support over the past week. Thanks to their efforts, all was quiet and peaceful in Helena and our state capital this past week. I also want to thank the soldiers of the Montana National Guard for their service, particularly those who went to Washington, D.C. to ensure we had a peaceful inauguration in Washington. They deployed rapidly, they got the job done, and they're coming home. Like many of you, I saw the images and read the reports that thousands of National Guardsmen were forced to leave the Capitol building and were sent outside or to parking garages to rest. Some had no heat or access to needed facilities. This is no way to treat the men and women in uniform. What happened to them was a national disgrace. Thousands of Guardsmen answered the call of duty to protect our republic, and they will have been pulling security duty for 2 weeks to support a peaceful transfer of power. And this is how they were treated? It's outrageous. That's why very early this morning, I instructed General Ronick to bring them home. I want to thank the members of the Montana National Guard who deployed in our nation's capital to keep the peace, and their mission was successful. President Biden was sworn in without incident. The transfer of power from one administration to the next was peaceful, and it's been as it has been since the dawn of our republic. And I want to congratulate President Biden on his inauguration as the nation's 46th president. I will work with the president to advance America's and Montana's interests at home and abroad. Where there are shared priorities between the administration and Montana, I will be willing to partner for Montana's benefit. Where there are differences, I will always be on Montana's side and be a strong voice for our interests. Unfortunately, many of the executive actions from President Biden and his 2-day-old administration aren't in Montana's interests. In particular, his executive order halting the construction of the Keystone XL pipeline is a bad deal for Montana. All the members of our congressional delegation, both Republican and Democrat, support the Keystone XL pipeline. My last 2 predecessors in this office support the Keystone XL pipeline. There is broad bipartisan support for the project here in Montana. Unfortunately, the president's executive action is purely partisan. The pipeline has been under review for a long, long time. It has been thoroughly vetted to meet safety and environmental standards. The project will create thousands of good-paying Montana jobs, many of them good-paying union jobs in our country and our state. It will provide hundreds of millions of dollars. Think of that. That money could be used for schools, infrastructure, local law enforcement to raise teacher salaries, but it's gone now because of the stroke of a pen. It would have kept our energy prices lower, and it would have provided our country with energy and security independence. But the president took all of that away in the first minutes of his administration with the single stroke of a pen. I will continue to urge the president to reverse his decision. Our response to the pandemic is yielding positive results. Our trend lines continue to be promising. We've gone from nearly 850 new cases per day about 2 weeks ago to under 400 today. We've gone from 208 active hospitalizations about 2 weeks ago to 138 today. None of our hospitals are at or above capacity. As of this morning, Montanans have been administered nearly 73,000 doses of vaccine, and nearly 14,000 are fully immunized. Our healthcare professionals have done an outstanding job getting Montanans vaccinated, and I want to thank them for their dedication and efforts. By the end of the month, nearly all residents and staff at nursing homes and long-term care facilities will have received their first vaccine and will be scheduled for a second. About 13% of tribal communities have been vaccinated, with more doses on the way. As I indicated earlier this week, the state of Montana is in phase 1B in our vaccine distribution plan. We improved the state's vaccination plan to save lives and protect the most vulnerable among us, those most at risk of serious consequences if they get the virus. Our vaccine distribution plan will save lives. The most vulnerable are now at the front of the line: Montanans who are 70 years of age or older, and Montana's 16 years of age and older who have a severe underlying healthcare condition, and Native Americans and other persons of color who may have an elevated risk of complications. That we are in the phase 1B of our vaccine distribution is great news. Unfortunately, not everyone in phase 1B can get vaccinated as quickly as we would like. We're doing the best we can with the limited supply we receive through the federal government each week. We want to do more, and we can do more. We are ready and prepared to administer more vaccinations. We just need more doses. We have been in contact with the Biden administration officials who have assured us that we will receive no less than what we receive each week, approximately 13,000 new first doses, plus the required second doses to complete the immunizations for people that got the first one. We will continue asking for as many doses as we can get. Many public health officials are doing an outstanding job setting up the logistics to serve the most vulnerable and to provide them with vaccines. Heavy call volumes are overwhelming many public health offices. I encourage our seniors and others most at risk to check the website or Facebook page of their local health department to see what the process is for receiving a vaccine. For folks who don't have access to that technology, please ask a friend or a neighbor to check for you. We are making great strides to save lives. The light at the end of the tunnel continues to get brighter. But as I said before, we're not out of the woods yet. We must continue to take proactive, precautionary steps to limit the spread of the virus. This includes wearing a mask. I wear one, and I encourage all Montanans to do the same. I also encourage Montanans to get the vaccine, which is safe and effective. When my name comes up, I'm going to get my dose. As I've said before, we are in a public health pandemic, but we're also in an economic pandemic. Last week, we removed restrictions on small businesses that limited their hours of operation and capacity. Montana small businesses, including many small restaurant owners, have sent their thanks. I am encouraged that many localities, including the Missoula County Health Department, very recently are following suit. As we make progress towards protecting the most vulnerable, we're also making progress to protect our small businesses owners who have weathered a great deal throughout this pandemic. Finally, we announced the last member of our cabinet a couple of days ago. Hank Warsich, a 17-year veteran of the Department of Fish, Wildlife, and Parks, will lead the agency. Our cabinet is filled with highly qualified change agents who are committed to making their agencies more efficient and responsive to the taxpayers that fund them. They are dedicated to improving customer service across state government, and they're ready to help me lead Montana's comeback. With that, I'd be happy to take some questions. Holly?
Yeah, I'm wondering about a legislative question. There's been changes to House Bill 3 that change some of the $800 million in appropriation authority for the federal coronavirus aid. I wanted to ask your thoughts about those changes and if they're changes that you support right now, and if you have any concerns about it that maybe hamstrings you as the executive when those funds are available to Montana.
Yeah, I don't have all the details right at my fingertips. My understanding, though, the revised HB 3 does have the funds that will allow us to continue vaccine distribution, which is our primary concern with the supplemental. Do we have a question online?
Yes, Governor, this is Casey Elliott from the Dillon Tribune. Our local public health officials are saying that people aren't getting tested if they have symptoms, and they say that this is a trend statewide. Can you speak to that?
Okay, Governor Quinn, General Quinn.
So this is General Quinn. I'm not aware, and we can certainly go back and check on Dillon, but I'm not aware that we aren't doing testing. We still see a good number of tests coming in through the state lab and through our university partner labs, as well as the outside reference labs. So not tracking any decline in testing for symptomatic individuals. Should still be occurring, and we encourage individuals who have symptoms to get tested.
Next question? Yeah.
Governor Zach Cabell, Montana right now. Question regarding legislative stuff as well. Over the past 15 years, a lot of the Republican proposed bills this past week, among others, some of the pro-life bills, a bill that would require transgender student athletes to play for the sport based on their sex. A lot of those would have been met with a veto by this office over the past 15 years. I'm wondering if you've been following those bills and if there's any plan as of now in your mind of whether to veto them or sign them into law.
Yeah, I don't want to get ahead of myself. There's a lot of bills moving through the legislature. I can tell you that anything that makes it to my desk will get thoughtful consideration. The bills we're focusing on the most are the ones that support the comeback plan. In particular, our trades funding, the increased pay for starting teachers, the tax reductions. Those are the ones we're tracking most closely. Is there a question online?
Hi, Governor. This is Caitlin Nicholas from Yellowstone Public Radio. Many teachers and other frontline workers have used all of their annual sick leave and paid time off, either in recovering from COVID or needing to quarantine throughout the fall. As the vaccine is distributed slowly just due to limited federal supply, does the COVID-19 task force have a plan to make sure these workers are able to quarantine when necessary this spring without being forced to go 2 weeks without a paycheck?
Yeah, so many Montanans have been impacted by this pandemic. Small businesses, teachers, our healthcare workers, and it is a serious situation. Our vaccine distribution plan emphasizes getting the vaccine for those most likely to have complications or die from the virus. I think our guide word here has to be saving lives. I was pleased that the CDC actually adjusted their policies to match what we did here in Montana. And for those teachers who have underlying healthcare conditions, the policy that our office has adopted for the state puts them at the head of the line, and they're eligible now to get their vaccines. Questions here? Yes.
Thanks, Governor. This is Iris Samuels with the Associated Press. You've said previously that COVID liability protection for businesses is needed in order for you to consider removing the mask mandate. So my question is, does Senate Bill 65 include all of the requirements that you were seeking, and do you intend to remove the mask mandate when that bill reaches your desk?
Yeah, thank you, Iris. So you're absolutely right. I think that we need to be prudent as we step forward. The two conditions for removing the mask mandate is that the vaccine is available to the most vulnerable, and we're making progress on that stage. I wouldn't say we're there yet. And secondly, we need this protection for small businesses, churches, teachers, and healthcare workers. We've been tracking the bill. We're encouraged by the progress, but ultimately we have to see what text actually emerges from the legislative process.
Hi, Governor. It's Bradley Warren from ABC Fox, Montana. I got two questions for you, but I think they're more for General Quinn. I'm wondering, one, what infrastructure is being put into place to ensure that these vaccines get out to those rural communities? And I'm also wondering what percentage of the vaccines are being distributed and what percentage is being thrown away or not used.
Okay, let me make a high-level comment, and then I'll pass it to General Quinn. I had a call this week with the executives at CVS that are taking care of about 100 long-term care facilities. They committed that by Monday next week, every one of their assigned facilities will have had a clinic, and every patient and staffer that wanted the vaccine would have been vaccinated. Walgreens committed that 97% of the facilities that they were assigned will have had that first clinic by the 27th of this month. So we're making good progress. That's a supply chain that goes directly to them. We've been in touch with Indian Health Services to check on our tribal communities, and we got verification this week that 13% of our Native Americans in the state have been vaccinated, at least with a first dose. So General Quinn, do you want to add a little color?
Yes, sir. Yeah, so as you recall the process, every Tuesday we get notified by CDC, here's how many vaccines you're going to get for the following week. And so we then query all of the counties across Montana to get what their desires are in terms of the vaccines and distribute from there. Again, tracking that Montana moves forward together from 1A to 1B and as they progress through 1B. So I think as we continue to work, we'll continue to work with counties, and if they have needs of support from the state to get out to the smaller communities, we will help them in that regard. I think the second question was the utilization of the vaccines. And so a couple things that the state had put out originally, one was never let a vaccine go to waste. And I think all of our county partners are doing an extraordinarily good job ensuring that those get put into the arms of individuals that need them, again, based upon the priority that we have. So we're not tracking wastage of the vaccines, and we encourage the counties and the hospitals to continue to utilize the vaccine, and if they have doses left over, get them into other people's arms that are waiting.
Next question? Yeah, Jonathan.
Thank you, Governor. Jonathan Amberian, Montana Television Network. I had a couple of quick clarification questions for you. When you say that the federal government guaranteed the 13,000 first doses a week, is that 2 doses for each of those people? And then the second quick clarification is it to your understanding, are all of the counties in the state now on to phase 1B, onto the 70 and older?
Let me answer your first question. I'll have General Quinn answer the second. This is how we understand what's been explained to us. We will continue to get about 13,500 new doses each week. And the supply chain is sufficient for the federal government to communicate to us that they have visibility, they can guarantee that. We expect that number to go up over time as supply chains ramp up. The way the federal government is doing the allocation is they are fulfilling second doses first, then doing additional first doses. So their willingness to commit to the 13,500 knows that they can satisfy the second dose demands for the ones they've previously shipped us. Does that make sense?
Yes, thank you.
Okay. And General Quinn?
Help me with question 2 again, if you would.
Yes, General, I just wanted to ask if all of the counties in the state have now moved on to the phase 1B.
I think there's one county that still is trying to close up 1A. They believe that will get closed up next week. They've been dabbling into 1B a little bit. Again, as if they have doses left over, they'll move into 1B. But for the most part, the state of Montana, in large part, is into 1B.
Thank you.
We'll take an online question.
Hi, Governor Gianforte. This is Marisa Giorgio with NBC Montana, and I have 2 questions, if that's okay. My first, a family physician in Missoula wants to know why health departments and hospitals are given priority in vaccine allocation when primary care clinics are trained to give vaccines quickly and efficiently and can reach out to patients directly, which they do every year with flu shots.
Yes, so General Quinn?
Yes, sir. So here's what we're encouraging our county partners to do and the hospitals to do, and that's work within the county. And we've seen good partnership across the state of Montana where we are allocating doses to the county. Those doses, if they're Pfizer, may go to the hospital because they have the storage capacity, but we're asking those county officials to work with the hospitals and the primary care clinics to spread that vaccine out evenly so that those who need it, again, back to Governor Gianforte's priorities that have been lined out, those who need it the most, get it. So the way that the county does that really is up to the county to do, and we encourage that cooperation across all providers.
Maritza,
All right,
you had a
thank
second
you.
question?
And my next
Yeah.
question.
I haven't forgotten about you.
Okay.
Go ahead, your second
With
question.
the announcement of a mask, with the announcement of a mask mandate on federal properties from the Biden administration, I'm wondering how does that hold up in the state once our statewide mandate is rescinded, and will there be clear messaging so there's no confusion for Montanans?
Why you need a mask on a national forest is incomprehensible to me. It is the definition of social separation. I think it shows a lack of understanding of our way of life, and we'll be communicating with the Biden administration that we don't think it makes any sense. Yes.
Hi, Governor. Shaylee Rager, Montana Public Radio. Thanks for taking the time today. I want to follow up on a question from my colleague from Yellowstone Public Radio. I understand that frontline workers will be prioritized in the vaccine plan, but we're wondering that if a frontline worker needs to quarantine in the spring and they don't have any PTO left or sick time remaining, is the state considering any kind of funding plan or payment protection to ensure that they don't miss a paycheck or can bounce back from that?
Well, we have a number of programs in the state to help people that can't go to work for some reason. I'm really pleased to share that basically frontline healthcare workers have been vaccinated. So they have a certain level of immunity. We know from the facts that this vaccine is incredibly effective and safe. So I really think the light at the end of the tunnel is getting brighter, and I think people will continue to get sick. COVID's not going to go away entirely, and we have programs to help people that can't go to work for whatever reason. Holly, you had another question?
One quick one to follow up on Shaylee and then a different track. So you said earlier, correct me if I'm wrong, there's been about 14,000 or 17,000 fully vaccinated in Montana?
14,000.
And so you said frontline healthcare workers are mostly vaccinated. Now, is that kind of the maximum desire within that group to be vaccinated? Or?
So let me explain the numbers. When I say most frontline healthcare workers have been vaccinated, they've had at least a first dose. Okay, so 14,000 have had 2 doses. Okay, so that's...
and then the second one, totally changing topics. Democrats held a press conference this week to talk about their tax proposals for this session. I wanted to ask, I understand there's been some conversation between leadership in that party, budget office, about a property tax proposal they had. I'm wondering if you see any opportunity for common ground there. And then also, if Democrats were critical of some of your proposals, saying that they benefit people kind of at the higher end of the income scale, and wanted to just have you talk a little bit about why you think your proposals are the best way to both help Montanans and get the economy going.
Yeah, I did meet with minority leadership again this week briefly, and our budget director met at length explaining our budget and our priorities. We'll take good ideas wherever we come from. There's no question that we need across-the-board tax relief. It should, particularly as it relates to property taxes, our focus is to help lower-income folks who are at risk of losing their home due to increasing property taxes. And we included that in our budget. If there's ideas to make that proposal better, we'll certainly consider them. Again, until legislation makes it through the process, it's hard to provide specific comments. Our approach on other taxes is to provide relief on a broad basis as possible. Montana has one of the highest personal income taxes in the West, and that discourages investment here. And we just need to make Montana more competitive. We're going to do that by lowering taxes for everyone. And our proposal would affect anyone in Montana that has taxable income above $18,500 per year. So that's an awful lot of folks. It's a majority of Montanans. We want to help them keep the fruits of their labor. Do you have an online question? Okay, back here in the room. Iris?
Thanks. This is Iris Samuels again with the Associated Press. And you mentioned that the Biden administration has promised 13,000 new doses each week. I'm wondering how that compares to the original promise through Operation Warp Speed, and if there's any difference, what that difference is.
Yeah, so we've been encouraged. What the current administration was it was the same commitment that was made by the Trump administration is now being made by the Biden administration, because it's exactly the same people that we're dealing with at CDC who are communicating the information to us. And basically what they've said is the supply chain is ramping up. We can assure you that the supply will continue at a minimum at the current level of 13,500 per week. We anticipate that it will increase, and that's what they've communicated to us. We don't know what those increases are or when they will occur. We're hoping it's sooner than later, because we want to get more people vaccinated. Are there any other questions here?
If I can ask one more question.
Okay.
You mentioned that in phase 1B, there just isn't enough vaccines right now to cover that entire phase. I'm wondering if you've offered any sort of guidance to local health departments on who should be prioritized, if they should first prioritize people 80 and up or anything like that.
Yeah, the priority is to help the most vulnerable. Some local health departments have decided not to start at age 70. They've started at a higher level. That was at their discretion. We just think the vaccine should get in the arms of people that are most likely to have severe complications or death. If I understand the numbers correctly, 75% of the deaths we've had in the state have been people age 70 or older. And then the additional ones tend to be people with severe medical conditions that are younger. So that's the priority. And then it's up to the local health departments to make the determination. Are there any other questions? Oh, one online.
Hi, yes, Governor. One more time. This is Casey Elliott. Do we have any data on the number of people declining vaccines and any reasons why they might be doing so?
Governor General Quinn? I can address
Yes,
it.
sir.
Yeah. So we are tracking this through the various channels. Uptake has been strong amongst healthcare professionals. Depending on which hospital we're talking to, uptake is 75 to 80%. Some people declining it have indicated that they're younger, healthy. They'd like to see it go to someone who's more vulnerable. That's noble, and I thank them for that. Amongst the broader population, indications are it'll be similar to the uptake of the flu vaccine, which is just over 50%, although as we're really encouraged, given we've done tens of thousands of needles and arms in the state, with the most severe consequence being a little sore arm, which is normal for a vaccine, we're finding that it's very safe, and I think as confidence builds, uptake will increase, and that'll be good for us getting through this pandemic together.
One more question is kind of along those lines. Have you noticed if uptake is different between different populations, say healthcare workers versus those 70 and under, those with that first set of health conditions?
General Quinn?
So, Holly, I think healthcare workers, for the most part, we're seeing good uptake on the vaccines. I think, as Governor Gianforte has mentioned, the uptake on the general population, as we look at the 70 above, that's going to be strong as well. 16 to 69 with severe underlying health conditions will be strong as well. And I think it'll get stronger as people see individuals coming out with a sore arm and no other side effects, and this is a very safe and effective vaccine. We continue to expect that uptake to increase.
And then one more, I think, for you, just in terms of people getting that second shot and the logistics involved with that, how has that process gone? Is it gone well, or have you seen any challenges just with people remembering, being able to get there, that sort of thing?
Yeah, I think it's gone extremely well here across the state. I think hospitals and public health departments are tracking when that individual is due for their second vaccine. Again, the supply from the feds have been very strong. They're on time with when we need that second vaccine. And so that really has gone very, very well. The public should have good faith in it.
I'll make one final comment just about vaccine distribution. CVS and Walgreens, the pharmacies that are taking care of our nursing homes and long-term care facilities, are actually scheduling 3 visits. And if there is some apprehension on the first visit, a staff or a patient could get their first dose on the second visit and then their second dose on the third visit. So we've built into the system an accommodation for people that might have a little apprehension, but when they see their fellow residents happy and smiling post first dose, they might have more confidence when they come back the next time. Thank you for coming out today. It's a pleasure to see you all.